As Rebecca just said, my name is Chantal, and I'm working at the CCGE at the University of Cambridge. And we're trying to increase trust and participation in early cancer detection research. And we're mainly trying to do this by implementing and evaluating an approach which we call the ROCKERS. It's a Research in Oregon Communities Review System. Very long, is it? And we implement this in Cambridge here in Peterborough. As you're all very well aware, there have been some improvements in early cancer detection in recent years in the UK. However, there are still major inequalities and inequities. So those for minoritized populations are still diagnosed on average at later stages of cancer and have subsequent lower survival rates. And this includes, but it's definitely not limited to, people from deprived areas, also from certain non-white minority ethnicities, including Asian or South Asian, Caribbean, or African backgrounds. It is therefore really important to do more research. However, minoritized populations are usually underrepresented in early cancer detection research. And unfortunately, that limits generalizability of findings across a range of different populations. But also, as there are many new early cancer detection tools being developed, it unfortunately limits positive impact on those populations who are underrepresented. Therefore, as I said, trying to increase participation and trust in those studies, we specifically trying to do that by implementing the ROCKERS system. And I'll tell you in a bit more detail what it is soon. We're working with two specific early cancer detection studies at the moment. One is Prevent Breast, and that's basically a study on risk assessment of breast cancer, and this is among South Asian and Black women. And they're recruiting South Asian women in Manchester, but here in Cambridge, they're recruiting people from the Black community. And we're specifically working with them. And the other study we're working with is ACE Cohort, and that's a biorepository for early cancer detection research. And they're also hoping to increase their diversity in recruitment. So what is this ROCKERS process? It's a systematic process in which the community is central, and it's developed at OHSU, and this is a university in Oregon, USA, and we're collaborating with them on this. So basically what's happening, researchers learning more about the community. They are considered experts in their community, and they receive recommendations and feedback about the feasibility of their study and also how they could improve it so they can increase participation. And the community members, I'll tell you a bit more about that too, they will assess these incoming research projects. And in my view, this is a very strong approach because of this community expertise that's being included and is central to it, basically. Alongside this, we are evaluating this process as well. So we're going to assess, is this feasible? Is it acceptable? What are general experiences of people participating in this process? We're mapping it onto theoretical framework as well. So basically what we'll be doing is, so we're organizing meetings with community members. I see here that we call it RAC meetings, but they are regional advisory committee meetings. So basically there are the community members across different groups. And I'm observing those meetings. I'm also interviewing researchers who are involved in the process. And I interview the members of those advisory committees. We're analyzing this, and our main aim is to assess, is this a good approach? Should we continue this in the future with other research projects? How could it be adapted? And so on. As it's, of course, important that projects are not just project-based, but potentially, if we can, establish long-term connections. And that is one of the strengths of this approach. So a bit more about the ROCKERS process. As I said, it's a community engagement system, and those regional advisory committees, they are really central to this. So what we did, we working closely together with the two studies, Prevent Breast and ACE Cohort. And our community liaisons went out to the communities, and we formed a regional advisory committee in each chosen region. Then we have three landscape meetings for each of those chosen regions. And basically in these meetings, we learn a lot about a range of different aspects that are important to the community. And we're developing a landscape document that will be shared with researchers to increase their learning. Then the researchers of the specific research projects will present their study to the advisory committee and request input. And we have discussions in this fourth meeting. And then after that, feedback is given about the study. And in our approach, we're following the Represent guidelines. I'll tell you soon a little bit more detail about what they are. And then it's up to the researchers to adapt their study based on the input they received. At the moment, we have 3 different regions where we have an advisory committee. One is in the Cambridge Abbey Ward area, one is in Huntington, and one is in Peterborough. And together with the studies, we selected these regions based on deprivation scores, diversity, but also in particular relevant for ACE cohort proximity to Cambridge. Because at the moment, they require participants to come to Addenbrooke's to donate or to participate in the study and give samples. So, yeah. I'll tell you a little bit more about our approach in Peterborough, because we've completed all the meetings that we had with our advisory group in Peterborough. So our first step was we worked with, so we have community liaisons included in this project, including Jim as well. And they reached out to PCVS, to different community groups, in person and online. And in the end, we formed a regional advisory committee. And there are 6 women between 30 and 50, which is the age range that Prevent Breast is particularly interested in. And they're all from African background, but they come from different countries. And they've all been living in the area for several years. Then we had basically 3 meetings with this advisory group. And initially we had a lot of prompted and unprompted discussions following a CPESL framework. And that's basically a lot of different aspects were discussed on technological, how are people using technology in relation to healthcare, for example, social, what are social but also cultural aspects that play a role in a lot of things, including research participation in healthcare, political, but also specifically cancer, because this is early cancer detection research. We were particularly interested what their views are on this. We are co-developing a cultural landscape document, which will be shared with researchers. And our experience was this created very rich data and a lot of important insight that researchers could use in the future, in my opinion. We then had a 4th meeting in which we invited the Prevent Breast researchers to present their research. They also took all their participant-facing documents. They even showed a video, which they have a recruitment video, which was quite interesting. And we had a very interesting unprompted discussion and feedback on their research project. And in our 5th meeting, the researchers were not present, but we went through the 12 Represent recommendations. They are basically recommendations that are developed to increase trust and participation in early cancer detection research. And they include a range of different recommendations, including establishing long-term connections, not bound by specific projects, but also establish systems to share resources with community members, training community champions, but also making study materials more culturally sensitive and using the appropriate languages. So based on a range of these recommendations, we're creating a specific feedback document that researchers could use to adapt their project. And as a result, then make participation more likely. So this is where we are at the moment. in Peterborough, we're pretty far. We're working on our landscape document and working on our feedback to the researchers. And in Huntington, which is, again, a very different group, and in Cambridge Abbey Ward, a very different group, we are about to complete all our landscape meetings. So this is roughly where we are at the moment. And as I mentioned, so we are asking our regional advisory committee members to provide feedback following these represent recommendations that are aimed at improving inclusion and trust in early cancer detection research. And these represent recommendations, they are specifically developed for early cancer detection. However, one of our next questions and a new project is, are these represent recommendations relevant across wider types of, different types of research? So we're currently exploring the potential wider value of them, and in particular for primary and community care research. And also, are there any potential barriers and facilitators to implementation? So what we're doing at the moment, I am going to interview community members to ask about their experiences of using the represent recommendations. They are the people who are also participating in our regional advisory committees. But I'm also currently planning a workshop with stakeholders and experts in inequalities, primary community care research, and so on. And as I'm aware that you're all very familiar with this field and very knowledgeable on inequalities in research and healthcare, I would be very interested in also hearing from you if you would like to participate in this. And if you're interested, you could send me an email on this address, and I'm happy to send you an invitation to participate in these. At the moment, they will take place on 18th of June from 9:30 to 12. And there's another one on 24th of June from 9:30 to 12. But I'm also planning to, so even if you're interested and you can't attend any of these days, we can still try to find a different day for those who are not able to attend any of these. And of course, thank you for listening, but also I would like to thank many others who have been involved in this project, including all our regional advisory committee members, members of our ACE network, including patient public representatives, people at the University of Cambridge, as well as in Oregon. So thank you.